Welcome to the Hip Health slideshow, and you're going to learn a lot in a very short period of time. So get ready and feel free to take notes. And then you see the neck of the femur coming out at a slight angle, and then it goes down to the femoral head. So a true ball and socket joint. And the nice thing about a ball and socket joint is it allows you to move the femur in a rotational plane, like your shoulder. Nerves, the nerves that innervate the hip muscles, come out of the lower back. So if you have a pinched nerve in your lower back, you may have a malfunctioning muscle in the hips, in the buttocks, and the rotators, and the outer hips, and the inner hips, and the pelvic floor, lines coming out of all the lumbar disc, L1, 2, 3, 4, and 5. All of those yellow lines are nerves, and at anywhere along the chain of the lumbar spine they can get pinched. And if they get pinched, well, then your muscles and things don't work as well, because if you're limping or favoring one leg, if you have aches or pains upon walking, any kind of pain when you're walking is really important to look at. Deep groin pain, loss of hip mobility, so all of a sudden you notice you've really decreased mobility. If that happens, then definitely you have a stability issue. And you can see that there is normal joint space between the femoral head and the acetabulum. And the arthritic hip, that space has diminished quite a bit, and it becomes very bumpy and not very smooth, and so that's when you tend to get pain. This is the #1 recommended non-drug treatment for arthritis is yoga and mindful exercise. So I hope that's why you're here. Yoga for healthy hips builds stability and flexibility. And there's me doing some of the poses, which we will do together in this course. So we are going to test on James his mobility, both in active range of motion and passive range of motion. First thing we're going to check is hip flexion. So bend your knee and then bring the knee in as far as you can on your own. Now when he's using his muscles on his own, that's active range of motion. He's actively using his muscles and bringing his leg to the degree that he can. So this would be his active range of motion. Now if I come in and I give overpressure to the knee and bring it as far as I can without force, and I can feel the catch right there, so that's his passive range of motion. Let's go across the body. Across the body is this midline stretch that asks the outer hip to stretch and the inner hip to tone. So I want to see if I can let his leg go while he brings the leg across the midline without lifting this hip off of the mat. Really good. Now I'm going to see, can I go a little further? Right there, yes. Welcome back. Now we're going to do hip series number 4, and this is going to be increasing the challenge quite a bit. So we're going to jump right ahead here and go right into runner's lunge and do a series of lunges and squats and yoga poses that are really going to progress your hip strength and mobility. Now, I see mobility as a function of strength and stability. So we always go through the lens of strength and stability first, which will yield more mobility over time. And that kind of mobility will be a mobility that will be sustainable for you. It won't destabilize the joint. It actually will help to stabilize the joint in its full range of motion. And that's when you know that you're feeling very healthy and strong, and you're going to be able to keep your strength and mobility throughout your lifetime. So you're going to go up here on the tall blocks. Now, if you don't have blocks at home, don't worry, just use a chair. And for some of you, you can just bring your hands onto the floor. A right leg is going to start forward and lift your chest and down. So those are the abductors when the legs go out and the adductors when the legs go in. Both are really essential for hip strength and stability. And then you can lean forward, and that's going to get a deeper stretch into this figure 4 hip in external rotation, right? So that's improving our external rotation. And it's improving our strength, right, into our standing leg. So feel the strength of that leg, feel the stability of your knee and your hip. And if you have any questions, don't hesitate to reach out. It's a pleasure to be on this journey with you, and I'm very happy to share my 20 plus years of experience. All right, thank you, and I'll see you on the mat. Take care.